So let me tell you about a patient whose life I saved yesterday. Not I, but we saved in our emergency room. So I left clinic a bit late yesterday because I had a lot of reviews to do. So I left clinic at 6:30, and then I decided to walk for like 30 minutes because I'd been seated in clinic the whole day, and that's not good. So I decided to walk around the parking lot of the hospital because I figured if I decide to go home, I'll arrive, it's late, I can't walk because now it was gonna be too dark. So while I was walking, I had done already 3,000 steps. Then I'm called by our emergency room medical officer. And then he tells me there's a 50-year-old patient who's just arrived in severe chest pain, and he was sweating so much, he was feeling nauseated, just feeling so bad. So when he came in, within 10 minutes, they had already done an ECG because the presentation looked like a heart attack. So they did an ECG, and he had what looked like a posterior myocardial infarction. So there was ST elevation. So it's what we call posterior ST elevation myocardial infarction. So when we say ST elevation, it means that one of the arteries of the heart is completely blocked, and it's just a matter of time before the patient becomes so severe, and some patients can actually die. So then, because I was just within the hospital, I ran back to the emergency room. And then in our emergency room, there's a pharmacy there with all emergency medicines. So we needed to give him a clot buster. So a clot buster will go into the artery of the heart and just dislodge that blood clot. So I went in, I introduced myself quickly. And then I told him that he was having a heart attack because, he had all the symptoms. A young man, 50 years, in severe distress because of chest pain, because of a heart attack in the emergency room. So I got the clot buster, we injected, and then we flushed it. He was still in distress, continuously. And then there are some medicines we give under the tongue to go and try open up the artery. We had already loaded him with the aspirins and the other medicines, yeah? And we're just monitoring him. We're just standing there, so many of the nurses in the emergency room, the doctors in the emergency room. So we monitored, and thankfully, that clot busting business was a success. How do you know that it was a success? So there are things we measure. His chest pain started coming down about 20 minutes after the clot buster was given. So the chest pain went down slowly, but by 20 minutes he was fully relieved. We repeated the electrocardiogram. So we had done one within 10 minutes, and then within the next 5 minutes the clot buster was in. So we repeated another ECG, and there was what is called more than 50% resolution of the ST elevation. So then we knew that the thrombolysis was a success. And because when we give a patient the clot busters, the risk for bleeding is very high. And then there's actually some questions you ask someone before you give the clot buster. So it was a success, and we continued to monitor him in the emergency room for about 6 hours. And then now we admitted him to the intensive care unit for continuous monitoring. So usually, even if the clot buster works, you still need to send a patient so that the coronary arteries are looked at using X-rays in a place called catheterization lab, so that we identify the culprit. So the culprit on that day was, it looked like it's either the right coronary or the left circumflex because it was posterior. I just don't know who was giving the posterior descending artery, but he will need to go to CATHLAB after that, maybe tomorrow, to go in, because you don't go straight to CATHLAB after thrombolysis because your risk of bleeding is very high. because in CATHLAB they use a lot of heparin if they're doing an intervention. So yes, I felt like we rescued someone's life, and I feel like we came in and we helped him because he'd gone to another hospital. His chest pain started at 2 p.m. By the time he was coming to us, it was 7 p.m. And for us, by 7:15, we had already given him the clot buster, the real treatment that he needed. And the reason we gave him a clot buster is because where I work, we don't have a catheterization lab. In another hospital where there's a cath lab, he would have been rushed in for coronary angiography with PCI. But we were still able to achieve, we were still able to restore blood circulation for him within a good time. So yes, that's the story I wanted to tell you guys.